Okay, today's episode is a massive one, but I hope that it's one that can be a resource for you moving forward if you are ever in the market for getting therapy. In this episode, I break down my approach and my framework for figuring out what kind of therapy is best for you and how to go about finding that therapy. So we go through all sorts of different therapeutic approaches. I explain the techniques, the benefits, the criticisms. I also talk about different modes of therapy like group or individual, couples, etc., and how we can find approaches that fit with the problems that we actually have. So as I said, it's a comprehensive episode. It's probably going to be a little bit longer, but stay tuned, listen through it, and you can always go back to the show notes if there's something that you don't remember or need to review later on. So buckle up, let's get started. This is the Hardcore Self-Help Podcast. I'm your host, Dr. Robert Duff. I'm a clinical psychologist and a self-help author from Southern California. My goal is to make mental health content for real people, just like you. And in this show, I answer your questions or dive deep into topics related to life, psychology, mental health, relationships, and more. Please be aware that sometimes I use some spicy language, and I also don't shy away from sensitive topics, but I will try to give you a content warning whenever it's relevant. So if all this sounds good to you, let's get started. All right. Hello, friends of all varieties. Thank you for joining me today. This is episode 397. And in this episode, I want to cover kind of a broad topic. I recently got a question from somebody that wrote in a very long question, and it was full of important questions and context, but it was just too long to include here in the episode. But it inspired me to work on the topic for this episode we're going to have here. So basically, this is the overview and the summary of what she wrote in. She is a 29-year-old woman struggling with trauma, mental health issues, and relationship challenges. And she is seeking guidance on where to start with therapy. She's had a long history of childhood trauma, like dysfunctional family, abuse, neglect, mental health struggles like suicidal thoughts, anxiety, depression, relationship issues, and she's just overwhelmed with the various types of therapy and wants to know where to begin. She is scheduled to see a psychiatrist soon, but she can't, wait that long. She wants some help now. So she's looking for guidance on what type of therapy to start with, how to address childhood trauma and relationship patterns, possible ADHD symptoms, and just finding a good specialist in general. So obviously this is very dense questions with a lot of important aspects that I would like to be able to address. But what I'm going to do in this episode is use this as a jumping off point to create a guide of sorts to finding the right therapy for you. So buckle up, this is going to be a big one, but I think that you will get a lot out of it. There are many types of therapy out there, and it can definitely be confusing to know what sort of therapist you should see, what sort of work you should do together, and which approaches are right for which particular issue, etc. I'm not going to be able to cover every single type of therapy, but what I want to do is give you some information about most of them that you will run into as you search for a therapist. And I also want to give you a bit of a framework to help you think about the searching process itself. So let's dive right in. From my perspective, there are three main dimensions that you'll want to consider when it comes to therapy: immediacy, problem, and approach. IPA, if you will, which is a drink that I rather enjoy. I will dive into each of these, but basically immediacy means what you will be focusing on. The immediate moment, the near future, the distant past like your upbringing. What time frame is the work going to primarily focus within? Problem is the actual issue that you're seeking help for, whether it's bipolar disorder, grief, ADHD, or something else. Lastly, approach. This is the actual nuts and bolts of what therapy looks like, the format, if you will. I'm not going to give you a magical formula here, but if you consider what you want and need within each of these dimensions, that should give you a direction to go in. Before I dive into the IPA, take a big swig of the IPA, let me briefly talk about the letters and qualifications of providers, because I know that can also be a little bit confusing. I'm going to be speaking from a USA-centric standpoint right now, because that's just what I'm familiar with. But you should be able to find information about the terminology for wherever you live online. I can only provide sort of my standpoint, though, in this episode. There are a few different terms that mean the same thing, and I want to talk about those. The most correct term probably is what you would call psychotherapy. That covers the umbrella of all the approaches that we're going to talk about here today. You could also hear it referred to as just therapy, which is probably more common, like, hey, I went to therapy today. Of course, there are other disciplines like massage or physical therapy that also use that term, so that could be potentially confusing for some people. You may also come across the term counseling. Often this still means psychotherapy, but the term can be used a little bit more loosely. For example, a church priest or elder may conduct counseling with someone, but that doesn't necessarily mean that they're a licensed therapist, right? Although the terms are often interchangeable, there can be some differences implied between whether somebody says they provide counseling or therapy. Ultimately, it comes down to the individual provider, so looking into their approach and services is going to be most helpful. Sometimes, though, counseling is meant to signify something that's more short-term, more action-oriented, usually with less overt psychopathology, meaning less focus on diagnosing psychological disorders and hitting it from that perspective. If you're unsure of whether the service that a provider is offering counts as therapy, look to make sure that they're licensed by their local licensing board. There are specific requirements and exams that differ between psychologists and master's level therapists, but we all need to get licensed before we can independently provide therapy. So just look for that on their website or whatever page you're looking at for them. Next thing we should talk about is that there are a few types of providers that can actually give therapy. In the US, there are quite a few actually. First off, it's not as common these days, but psychiatrists who are medical doctors, meaning MD or DO, are able to provide psychotherapy. They are allowed to do that. General practitioners are not, but people who have that specialized training can do that. Psychiatric nurse practitioners who are working underneath a psychiatrist, they fall under the same umbrella. Not many of them provide therapy, but some of them can, but you're more often going to see that from the psychiatrists themselves. Then you have your non-medical doctoral level professionals like me. This would be your PhDs and PsyDs. And PsyD is a specific psychology degree called a Doctor of Psychology, whereas PhD is broad and you could have a PhD in physics or psychology or, any number of fields. Please note that anyone with a doctorate level psychology degree is not automatically allowed to conduct therapy. If you go to school and get a PhD or a PsyD, that doesn't mean you can jump in and start doing therapy. That requires passing a law and ethics exam, as well as a licensure exam called the EPPP, the Examination for Professional Practice in Psychology. If you followed me for a long time, you saw me go through this process, and it's very rigorous. It's a lot of preparation, a lot of money, a lot of stress. So you can't just sort of pop out from school and then go straight into doing therapy. There are a lot of hoops to jump through and a lot of additional things that you need to do to make that happen. Next, there are a whole bunch of master's degree level therapists out there. Letters could include MFT, MA, MS, MSW, LCSW, LPCC. There are quite a few. The most important part is to remember that they also have the same sort of thing where they need to pass a licensure exam and their own law and ethics exam to provide therapy. It's a different set of examinations from the psychologist ones, but they do need to pass those in order to actually provide therapy as a service. In some states, you can also get therapy from a licensed drug and alcohol counselor, which may not have a specific degree requirement, but it does involve specific coursework and passing of relevant exams. This therapy tends to be limited, though, to that specific topic of addiction or substance abuse and the issues surrounding it. Now, there are some areas where you will want to be cautious, and this is in regard to coaches and pastoral or other spiritual counselors. For pastoral counselors, these are church figures that provide faith-based counseling. There's nothing inherently wrong with this, except that the requirements and oversight and what they actually treat, they vary widely depending on where they are. But of course, this is also something to consider in terms of culture. You may exist within a culture where therapy is not very supported, but going to, a church elder, a spiritual counselor, a shaman of some type, whatever it might be, is more accessible and is more culturally appropriate for you. So, of course, take this with a grain of salt, but when it comes to just sort of the oversight of it, it does have a different type of oversight, and it's not quite as rigorous as it is for somebody who provides professional counseling or therapy. And then, of course, as I said, the actual things that they might treat vary widely depending on where it is you're talking about. And then for coaching, there are many legitimate forms of coaching, and some are provided as an additional service within or outside of the therapy process, right? Somebody who has a PhD in psychology, who is licensed to do therapy, may also do executive functioning coaching for people with ADHD, which we'll talk more about later. But the term coaching is pretty unregulated. To me, it's kind of like the vitamin and supplement market. Sure, some of it is legitimately helpful, maybe even backed by research, but there's also a lot of overpriced snake oil, a lot of inappropriate promises, and it's just something that you need to be careful of. So if you're out there looking for somebody to help you with a mental health disorder, be sure to find somebody that's licensed to conduct therapy. If you're looking to get help with, putting your life together in some specific capacity, coaching can be great, but you don't have those same kind of protections, and there are typically no barriers to entry to just calling yourself a coach. I could put phrasing coach on my resume if I wanted to, because I spend so much time helping people come up with the right way to say things, but that doesn't mean I have any qualifications for that. So hopefully this gives you a good idea of the terminology and the types of providers that you may run into in your therapy journey. Next, I want to get into those different dimensions that you might consider when figuring out what kind of therapy to get. But first, let's take a quick break and talk about today's sponsor. Okay, today's episode is brought to you by OneSkin. OneSkin is a company that I very much enjoy. I've been using their product ever since they first started sponsoring me quite a while ago at this point. And if you have sensitive skin, you'll want to listen up because you know how hard it can be to find a product that doesn't cause irritation. OneSkin makes that easy. Their topical supplements are formulated with soothing ingredients and natural antioxidants, plus they're gentle enough to use every day even if you have sensitive skin. OneSkin was founded by an all-woman team of scientists, and their products are backed by extensive lab and clinical data to validate their efficacy on all skin types. They're the first skin longevity company to target cellular senescence, which is a key hallmark of aging. What does that mean? That means the actual dead cells, it prevents that process from happening, which can help to reverse signs of aging physically in your skin. I also think that their products are really great because they're simple. The packaging is very simple and sleek and attractive. They have a very small line of products, but they're all backed by that OS1 peptide, which is that peptide that reverses skin's biological age by reducing those senescent cells up to 50%. This has been verified by third-party research organizations. And yeah, it's so easy. You can use it for your face, you can use it for your eyes, you can use it for your body. They have different products for all of these. And in the morning, I just wash my face, bing, bang, boom, I'm done, I'm out the door, which is perfect for me. So by focusing on the cellular aspect of aging, OneSkin keeps your skin looking and acting younger for longer. You can get started today with 50% off using the code DUFF at oneskin.co. That's 15% off at oneskin.co with the code DUFF. After you purchase, they'll ask you where you heard about them. Please support the show and let them know that. All right, so let's get into the different dimensions that you want to consider when figuring out what kind of therapy to get. Starting with immediacy. So that's the I in IPA. So immediacy, there are a few things that come to mind as the most immediate when it comes to therapeutic approaches. Let's say that you're looking for help right away. These would be things like crisis counseling, rehabilitation therapy, and solution-focused brief therapy. I'll also mention that there are modified versions of approaches that we'll talk about later on that would fit into this category as well. Things like brief cognitive behavioral therapy or brief psychodynamic therapy, basically a shortened version of a different approach. But yeah, there are approaches that are meant for right now. The first two approaches that I mentioned, crisis counseling and rehabilitation therapy, these are usually things that you would be referred to during medical treatment or in response to a crisis. You may be encountering these approaches at a facility where you've been hospitalized or where you're engaging in detox and rehab. But basically the goal here is to stop the emotional bleeding, which will give you immediate coping tools and to help you develop a more sustainable plan, which typically involves connecting you to other providers. You're not going to go deep here. You're not going to get into the really deep stuff. This is just about stabilizing you and directing you toward other resources. Solution-focused brief therapy is very much what it sounds like. It's a short-term approach that's very goal-oriented. The idea here is to identify solutions to problems rather than spending a ton of time dwelling on the problems themselves. The underlying belief is that people have the resources and the strengths to solve their issues, and the therapist is there to help the person identify and utilize those resources. So the duration of therapy for this solution-focused treatment can last from 3 to 10 sessions, so pretty short. And you might encounter techniques like the miracle question, where you imagine a miracle happened and your problem went away, and you work through the day step by step to identify those little pieces. Scaling questions, where you do 0 to 10 scales of things. Exception seeking, where you look for the exception to the rule, times when you are coping well or times where that problem is not there. And coping questions, as I said, very, very action oriented. And this approach is good for things like depression, anxiety, stress, relationship problems, life transitions, trouble at work and school. It's not necessarily going to be the most helpful for more severe psychological issues, but it's good for stuff where you just need some tools now to get you back on track. So those were the most immediate. In the next category, we have approaches that are more focused on day-to-day issues, but they also look a little bit toward the future. Many of the main therapeutic approaches are going to fit into this category. Some of the biggest names are cognitive behavioral therapy, dialectical behavior therapy, humanistic or person-centered therapy, acceptance and commitment therapy, and there are plenty more, right? There's a lot of different approaches out there. This could go on forever. So I'm just going to jump into the details of some of them to give you an idea of maybe some of the most common. So first, cognitive behavioral therapy, CBT. This is one of the most widely used approaches in psychology. Most of you have probably heard of it. It focuses on identifying and changing negative thought patterns and behaviors. Basically, it looks at the interplay between thoughts, feelings, and behaviors. That's what you call the cognitive triad, or the Triforce, if you're a nerd. But it looks at that interplay between all of those things. And the approach tends to be structured. It often involves skills training, homework assignments, and in-session exercises that you do with your therapist as well. For instance, you might spend some time learning breathing and grounding strategies for your anxiety. You might also focus on learning about and identifying your common pitfalls when it comes to negative automatic thoughts. For example, if you tend to personalize a lot or you tend to think in this very polarized black and white style, you'll zero in on that and start trying to find alternative ways to think about those situations, which can lead to a better emotional outcome. Now, some of the criticisms of CBT include that it overemphasizes cognition, meaning thinking, while ignoring some of the deeper issues. It can also be very structured, which some people do not enjoy. And some of the solutions might seem superficial, right? Like you're going to think your way out of a situation that maybe is bigger than that. And these are valid criticisms. I would add as well that CBT requires a certain degree of motivation and also a certain cognitive ability to think about your own thinking. And that can be tough when you're really struggling. When you're in the thick of it, so much heady work might not be very endurable for you. But I would say a good CBT therapist will also be sensitive to this and will adjust the approach as necessary for what you're going through at the time. In my experience, most CBT therapists don't do strict CBT. There are certainly those who do manualized treatments, which are very, very structured, and those are prone to some of those issues that I mentioned, although they are research supported. But most CBT therapists have at least some degree of integration with other approaches and styles to make it work for the individual. And I'll just say right now that many therapists out there don't stick very, very firmly to one sort of framework, one therapeutic framework. A lot of people these days are integrative and they take pieces from different approaches, but many of us have maybe one or two that are sort of our bread and butter. So moving on from CBT, let's talk about another BT, which is dialectical behavior therapy, or DBT. DBT was originally developed to treat borderline personality disorder, but it can be used effectively for a variety of issues. It essentially combines cognitive behavioral techniques with mindfulness practices, with the objective of helping people regulate emotions, develop healthy relationships, and manage distress. DBT is an amazing tool for building distress tolerance. So if you're somebody that finds that you have a hard time emotionally regulating and that your life becomes disrupted due to emotional reactions getting out of hand, DBT would be one of the approaches to consider. A formal course of DBT typically includes both group and individual treatment, which is necessary to have the greatest impact. And it's perhaps one of the most learning-focused approaches. It can be very highly structured. You're going to learn techniques and acronyms galore, but the idea here is to give you a lot of practical tools that you can use to regulate your emotional reactions and have better control over your behavior. It's particularly helpful for people that have issues related to, obviously, borderline, but also self-harm and suicidal ideation. Some of the criticisms of DBT are that it requires a lot of time, that it can be too rigid, and that it's very, very prescriptive, meaning you're told what to do by the therapist a lot more than in other therapeutic approaches. Okay, on to humanistic and person-centered. I'm going to group these together. You could split hairs about the differences. Basically, person-centered therapy is a specific form of humanistic therapy, which is what you're mostly going to encounter out in the wild. It's person-centered therapy developed by Carl Rogers, who, if you ever see a YouTube video of him, I encourage you to look him up, Carl Rogers. You can see him doing work and you'll totally be able to understand the approach just by seeing him talk. He has a very calm, almost like grandfatherly demeanor, and this approach focuses on things that you might assign to that. It focuses on creating non-judgmental, accepting, and an empathetic environment. And this allows space for client growth and self-discovery. So the goal is to help clients achieve greater self-understanding and greater self-acceptance. The three main tenets of the person-centered approach are unconditional positive regard, meaning no matter what you do, the therapist is always on your side. They may not always agree with your choices. They may not, praise you for things that they don't want to be praising you for because they might not be good choices, but they always care about you and they're always on your side. So unconditional positive regard, empathy, and the accurate expression of empathy, meaning, trying to accurately reflect back what someone feels to them, and congruence or genuineness, just being a real person, being genuine, not trying to be this lofty figure that is the authority and creating a power imbalance. It's about being, sort of just a real person, sitting with the other person, allowing them to speak and trying to reflect back to them. You're not trying to hide behind a professional facade, but be real with somebody and work hard to accurately portray that you care and that you have empathy for the client. That's the person-centered approach. A lot of people will integrate person-centered elements into their therapeutic approach, even if they're doing something like CBT. To me, it's like the bread and butter of being a good helper in general. So you're naturally going to fall into a lot of those person-centered techniques if you're just a good helper. Now, there are some criticisms of person-centered therapy, especially if it's just the primary approach and it's the only thing you're using in treatment. It may not be sufficient for people with more severe mental health conditions. It also has a lack of structure, which can be frustrating for some people. The therapist tends to be neutral and very non-directive, meaning a lot of those things where you see a stereotypical picture of a therapist going, well, how does that make you feel? Or, when they ask a question like, well, why did you ask that question? Kind of pushing things back to the client and having them continue to elaborate, that drives some people totally crazy. So that can be a limitation in some cases. The next one is acceptance and commitment therapy, or ACT. Importantly, with ACT, you don't say ACT, you say ACT. That's something that's very important to practitioners of ACT. And this was developed by Stephen Hayes. The focus of the approach is helping people develop psychological flexibility and acceptance of difficult emotions. So with ACT, you help people clarify their values. So you look deep and see what drives you, what are your values, and then take action toward living a more meaningful and fulfilling life. There's a heavy emphasis on mindfulness and acceptance of the present moment. So rather than getting rid of feelings, the idea is to live a more meaningful life and be present in the moment, despite the fact that you have difficult thoughts and emotions. There are some key techniques that you might encounter in ACT. These are things like cognitive diffusion, meaning detaching from your thoughts and recognizing that they don't necessarily have to dictate your behavior or reality. Values clarification and behavioral activation, meaning getting in touch with your values and taking steps toward them through action, are huge parts of it as well. And I think there are a lot of elements from this approach that are great. There are many elements that I like to integrate into my own practice. One of the main criticisms of ACT is that it can be kind of abstract and hard to apply. And there are also criticisms that the actual goals of therapy, like psychological flexibility, are pretty subjective and they're really hard to measure in research. So let's now look at the last category here in immediacy, right? We're talking about the I of the IPA. So we talked about the most immediate. We talked about sort of that intermediate, looking at now and the near future. Now we want to look at treatments that focus more on the past. You might refer to these as insight-oriented or depth-based approaches, meaning going deep. Some of the approaches that fall into this category include psychoanalysis, psychodynamic therapy, Jungian therapy, and internal family systems. Some of these approaches get some flack, which I can understand. They can be a little bit more abstract and less nuts and boltsy than the other therapies. There was an important study, though, I want to point you to, done back in 2010 by Jonathan Shedler. And this looked deep into the evidence to show that these depth-based approaches can have unique benefits, such as increasing benefit over time rather than decreasing. So with CBT, what you tend to see is a really fast reaction that decays over time. But the theory here is with these depth-based approaches, and this was supported by this research done by Jonathan Shedler, is that over time, the benefit actually increases because you're going deep. You're actually changing things down beneath the surface, and that's going to have more of an enduring change over time. All this is to say, they might be worth your time, especially if you're not finding luck with other approaches. So let's jump into them. Starting with psychoanalysis, this is the therapeutic approach developed by Sigmund Freud, and it's your stereotypical picture of a therapist sitting behind somebody while they lie on a couch and they free associate. The theory here is that by exploring early childhood experiences and repressed emotions, you can bring the unconscious up to the conscious level, which leads to emotional and psychological change. Traditional psychoanalysis is still around, but it's much less common than other approaches. One reason is that it's lengthy and expensive. I mean, I'm talking multiple sessions per week. Think 3+ sessions per week, sometimes over the course of years. And often this is paid for out of pocket. So that really, really adds up. If you look at the geographic locations that this is the most popular, like for instance, it's more popular on the East Coast of the United States, it does tend to line up with kind of high socioeconomic status, which you can draw some conclusions about. But yeah, it definitely is something that is not accessible to many people. Another criticism of psychoanalysis is that it has less research support compared to something more structured, like say CBT. And it's also pretty therapist-driven, meaning it's the analyst's job to actively interpret the patient's unconscious mind, which can feel disempowering for some people that like a more collaborative approach. There's another approach to therapy that was born from psychoanalysis, which is called psychodynamic therapy. It takes the core ideas like the influence of the unconscious mind, the impact of early childhood experiences, and the importance of interpersonal relationships, and modernizes them. It still focuses on deep reflective work, but the duration and intensity is way less than traditional psychoanalysis. I am a fan of this approach, and I definitely integrate elements of it into my own style. My advisor in graduate school was heavily psychodynamic, so that definitely bled into my own approach. But psychodynamic therapy is not for the faint of heart. You'll be asked to reflect on your past. You will be called out on things in session. You'll be focusing on the actual relationship between you and your therapist during session and processing that. So it can be a lot. The criticisms are mostly the same as psychoanalysis, although there is more research support for psychodynamic therapy. It can still be found to be a little bit subjective, a little bit less structured than something like CBT, but it is effective. And if you're going to be going for the analysis route, most people are going to go with psychodynamic therapy. The next one is internal family systems, or IFS. This is another interesting depth-based approach because this is based on the concept that the mind is comprised of different sub-personalities. Not in the pathological sense, not like with dissociative identity disorder where you have multiple personalities, but rather that we all have different parts within us. And these parts include wounds that carry pain and also protective parts that try to manage and control that pain. So the focus of therapy is to bring these different parts into harmony and develop a strong core self that can guide the internal system. The work in therapy actually involves identifying these parts and accessing them in session. So you might have dialogues between your core self and your other parts. You may also work to sort of unblend your parts, meaning separate them from your core self, and then learn to observe those other parts of you from a place of calmness and compassion, rather than feeling overwhelmed by them. The research support for IFS is growing, but there is some criticism about the quality of the research that's out there. And it can also be a hard approach for practitioners to pick up because there's just so much theory behind the model. So if somebody integrates elements of IFS into their approach, what that actually looks like can vary quite widely between practitioners. So it's a newer one in terms of the research, and not everybody is fully aware of how to use the approach when it comes to being a practitioner. But it is a very interesting approach, and some people benefit greatly from it. The last depth-oriented approach we'll talk about is Jungian therapy, which is the type of analysis developed by Carl Jung. Similar to Freudian psychoanalysis, this approach emphasizes the role of the unconscious mind. And it's different in that it explores deeper levels of the unconscious mind, including the personal and the collective unconscious. The collective unconscious has archetypes and symbols that are thought to be universal and shared by all humans. These are things like the hero or the shadow. And in this therapy, you'll do things like exploring of these archetypes. This is where you might get into dream analysis and looking at your own personal myths and symbols. And if you learn a little bit more about Jungian therapy, you're going to start to see the way that it's penetrated pop culture, especially pop psychology. For instance, this is where we get that idea of getting to know your shadow self. There's a lot of terms that are very zingy. They just sound good and they make some sort of intuitive sense, and they very much tie into the legends and myths and things that we know from culture over our lives. So yeah, it does work its way into pop culture quite a bit. Jungian therapy does not have a great deal of research support, and it has some of the same pitfalls as the other approaches that I mentioned in this section, like being abstract and being subjective. Personally speaking, it can be a little bit kind of wooey and mystical for my liking, but to each their own. If you're sort of a spiritual person, not necessarily religious, but kind of spiritual, maybe a little bit witchy, you might find that Jungian therapy fits with your worldview more, and it's a good entry point to therapy. Okay, so now I've given you an overview of some of the most common types of therapy and their levels of immediacy, right? That's the I. So let's talk about the next dimension, which is problem. So that's the P in IPA. So problem. Another way of looking at therapy is to consider the problem that you need help with and finding approaches that are shown to be effective in helping with that particular issue. So let's start with trauma. You probably already know one of the main approaches here, which is called eye movement desensitization and reprocessing, or EMDR. EMDR was developed specifically to help with distress associated with traumatic memories, and it's considered to be one of the most effective treatments for PTSD and other traumatic reactions. The work in EMDR can vary, but it involves having clients recall traumatic events, meaning, bring up those memories, while engaging in what's called bilateral stimulation. This could be through rapidly moving your eyes back and forth. The classic way is by having a therapist move their hand from side to side, and you follow that with your eyes, not your head, but just your eyes. There's also different things like light bars where you follow the light. There are online and computerized approaches, but basically shifting your eyes back and forth. That's where the name comes from, eye movement. You can also do things like tapping on either side of your body, like butterfly tapping. So if you cross your arms, tap your right hand on your left shoulder, your left hand on your right shoulder, alternate back and forth. You can use auditory tones going back and forth in headphones, many different ways. And the theory is that this helps you to process and integrate traumatic memories, which then reduces their emotional impact. With all trauma therapy, EMDR included, it really capitalizes on the fact that our memories are fallible, meaning when we pull up a memory, we store it with new context, new cues, and that memory actually changes when we put it back in. So you can process these traumatic memories and reduce the amount of threat and emotional impact. The thing with EMDR is we know it's effective, but there are many that believe the bilateral stimulation part isn't actually what helps. Or there are some people that think it does help, but they don't know exactly why. With EMDR, there are many elements like learning coping skills and self-regulation skills, identifying past learning experiences that have led to trauma, and gradually exposing yourself to the internal sensations of recalling trauma that are all effective elements in and of themselves. So there's some question of, is it the bilateral stimulation? Is it the other stuff? Is it the combination of them? I think that it's going to take some more time for research to really shake that out, but it's contested. That said, we do know it's effective, so don't get that part twisted. Now, more recently, there's been another approach called brain spotting, And this has become increasingly popular. I see it a lot in my therapist groups, people looking for trainings on it, people asking about it. It has a similar feel to EMDR, but it focuses on where somebody looks with their eyes and that impacting how they feel. So the therapist, there are techniques for this, but the therapist will have you focus on a brain spot, meaning, okay, go look back at that spot where you had that thought, where you had that feeling. And you'll look at that spot while discussing bodily sensations and emotions that come up. And it's a similar kind of thing where this is going to help you ease the trauma and other psychological issues by processing them. The research for brain spotting is still fairly young, but the early reports are promising, with it showing similar effectiveness to EMDR, but more research should be done. There is this effect that I think you should always watch out for with emerging therapies, where they have a name that's very snazzy, it rolls off the tongue, and you get this sort of evangelistic group of providers that just swear by the treatment. Like, this is my jam. They get trained maybe by the person themselves, and they really push this treatment. And this can cause people to overlook some of the deeper concerns with research. Kind of like how I view EMDR, right? So who's to say that brain spotting also isn't just benefiting from the universal elements that it shares with other approaches to treating trauma? This is where time and more research will tell. Like, I'm not going to make any conclusions about that, but, something to consider. The research here for this particular approach is fairly young, but in the end, if it works, it works. And if we don't know why, who cares? Another evidence-based approach for trauma is trauma-focused CBT, or TF-CBT, right? Trauma-focused CBT. And this approach is what it sounds like. It integrates cognitive behavioral therapy principles with trauma-sensitive interventions. Therapy often includes education about how trauma works, cognitive processing of those traumatic memories, and of course, teaching coping skills like relaxation and cognitive restructuring. One of the cool things about trauma-focused CBT is that it often includes the family or support network as part of the intervention, which I really like. And of course, there are others as well, too many to list. But the core features that are generally similar in trauma treatment include learning how to regulate the body. This could be through grounding, through deep breathing, or other strategies. Identifying traumatic events that have caused the current reactivity that's happening, and then approaching and exposing yourself to those memories of the trauma so that they can be reprocessed and become less immediately threatening. And that serves two purposes. One, it helps you normalize the experience of feeling anxiety when those triggers happen. And then the other one is that memory thing where you're trying to restore it as a memory that doesn't feel like it's happening to you all over again. So some other approaches to look out for would be prolonged exposure therapy, cognitive processing therapy, narrative exposure therapy, and somatic experiencing. They all have different elements to them, but lots of valid approaches out there. Obviously, I'm not going to go into every conceivable problem that you may seek therapy for. I'm just trying to give you this framework. But since the person that asked the question for this episode directly asked about it, let's talk about ADHD treatment. There are a variety of approaches that can be helpful for ADHD. What you're going to want to look for is somebody that specializes in ADHD, and then secondarily take a look at what particular approach they use. CBT and more strict behavioral therapy are often suggested for ADHD to help the person minimize the emotional impact of ADHD, because that can be a huge part of it, and then also develop skills for managing emotions, organization, time management. Behavioral therapy would be more common for children, and this is where treatment might involve parents, hopefully teachers as well, to help reinforce positive behaviors and implement consistency in routines. Educational therapy is another type of treatment that focuses, again, on this idea of building skills, but that tends to be more specific to school, and that can include study habits and how the kid can self-advocate in a school environment. Outside of strict psychotherapy, you may also find people that market themselves as executive functioning coaches, and this looks less at the emotional experience of it all and focuses more primarily on building practical skills, those things I talked about, right? Organization, time management, etc. So if you're looking for therapy for a specific issue, have a look at the approaches that are indicated for that issue and then go from there. Like I said, I'm not going to cover all of these approaches. We already talked about DBT and how that was made for borderline personality disorder. Phobias would match really well with behavioral therapy and CBT. OCD would be really good with exposure and response prevention therapy. You get the idea. There are some sort of gold standard approaches that line up with specific problems. Okay, so now on to the final dimension of this IPA framework, which is approach. Now, I talked obviously about a lot of approaches to therapy, but for this dimension, I more mean essentially the format of therapy, what it looks like. Across all different types of therapy, there are also many different formats, which would be potentially important for you to consider. First thing to think about would be in-person versus online. This is pretty straightforward, and really it comes down to personal preference. The clinical research has consistently demonstrated that online therapy is similar in efficacy to traditional therapy. Personally, I was doing online therapy well before COVID, but since then, the prevalence of online therapy has blown up. So there are many people who do online only, there are some people who do in-person only, and there are some people who do a blend of the two. So whatever floats your boat, they all work. Other formats to consider would be family therapy or relationship therapy. Again, these are pretty self-explanatory, but you can have therapists of any modality that we've already talked about that also provide family or relationship therapy under that umbrella. In some cases, you can have individual sessions with these providers, but the focus is going to be on treating the group, whether that's a family, whether that's a couple, or any other relationship structure. That's going to be the focus, and individual sessions would likely be the exception there. An underutilized type of therapy, in my opinion, is group therapy. It's important to remember that group therapy is different from a support group. A support group is generally led by peers or some sort of coach figure, whereas group therapy is actually a form of professional therapy done in a group setting, and it's led by one or more licensed therapists. So it's actual therapy. And there are many different types of groups out there. Again, this could be in-person or online, but there are groups for anxiety, for OCD, for addiction, for emotional awareness and general processing, for grief, and on and on and on. Many different groups out there. Moving on, there are also more sort of expressive approaches to therapy. These would be things like art therapy or somatic therapy. And these involve creating art of some kind as a means to process feelings, or moving your body as a way to tune into emotions, to work through traumas. You know, you've heard that term, the body keeps the score. Well, sometimes moving your body is a great way to, work through that. There are tons of subdivisions within these categories, so be sure to read up on just the individual or the group's approach in particular, because you can see all sorts of things. You might even see group art therapy. A more recent development is what you might call substance-assisted therapy. These would be things like ketamine-assisted therapy or MDMA-assisted therapy. Obviously, the legality of these substances varies by region. These days, ketamine therapy is pretty easy to come by, but something like MDMA-assisted therapy for trauma is not easily obtainable yet outside of clinical studies, and same would be the case for something like psilocybin, magic mushrooms. The important thing here is that there's a difference between simply getting the substance and doing substance-assisted therapy, right? A lot of people have had the experience where they park their butt in a chair and get a ketamine infusion. And that's helpful, but ketamine-assisted therapy is a specific tailored psychotherapy approach that integrates the use of ketamine intentionally along with therapeutic approaches. So it's a different beast. And finally, there are also some ways to get creative with the duration and the intensity of treatment. Some people do retreats, for instance, that involve both individual and group therapy. Some therapists will also offer longer sessions, like half a day intensive session, rather than coming in, 1 hour at a time, week after week. All of these are valid, but they are less likely to be covered by your insurance if that's something that you need to do. The last thing I'll say about all of this, now that we've covered sort of the general framework, the IPA framework, is how to actually find a therapist. And there are a few key methods for this. Generally, the most effective is using something like Psychology Today's Find a Therapist tool. Just go to Psychology Today, there's a link, you click it, find a therapist, and you can go from there. Once you put in your city or your zip code, it'll show you a bunch of people in your area. But the real secret sauce is when you start using the advanced filtering. This is where you can apply the framework we talked about here, right? First, you can put in your insurance if you want to use it. You can put in the problem that you're dealing with. You can specify the type of therapy that you want if that's important to you. One tip is that, especially on Psychology Today, you might kind of feel boxed into your local area, but usually if you go up to the top, it'll subdivide it. So it'll be like, for me, for instance, say I'm looking in Ventura, California, right, which is a city close to me. It'll say, USA, California, Ventura County, Ventura. If you click on the California link, that will broaden the search to everybody within the state of California. And when it comes to online therapy, you can technically see anybody who is licensed in your state. So that really, really opens things up. But yeah, you can use all those search tools to really get granular about the people that pop up in those results. And aside from Psychology Today, there are others. You can use your local psychological association. So if you just Google, for example, same city, Ventura County Psychological Association, they will have tools similar to Psychology Today. And there are more and more therapist search tools popping up. So definitely use the internet. And doing a little bit of Google foo, online helps out quite a bit too, because sometimes people aren't, using those different search engines, but they have their own website. So you can type in something like, say, OCD group near Houston, Texas, and potentially find some good places to contact there. If you are going through insurance, typically your insurance company also has an online portal with search tools for behavioral health providers, which will include therapists and psychiatrists. These tools, they're hit or miss. They can be kind of clunky, and sometimes they're not updated very often. And of course, if needed, if you're working with somebody who doesn't really use the computer a whole lot, they can still print out and mail you copies of them. If you represent a specific population or you're part of a particular community, there may be collections of therapists within that community that you can find. So for example, I know people have found me through the effective altruism community. They have like an ongoing spreadsheet of therapists. I know there are similar collections for people, say, within the kink community, probably within certain religious groups. Many subgroups probably have, collections of people that they feel are aligned with their community and their values. Schools with psychology training programs are also options. Often you can find free or low-cost treatment with the students there. And also they sometimes have staff, professional therapists that provide services to the community. If you're low income or you have severe mental illness and there just are no resources around, you might be looking at community-based mental health. So just Google community mental health in your area. These are going to be kind of local government organizations, often, supported through tax money or grants or things like that. In these situations, you may not get kind of the top of the line, most individualized treatment, but it's an option that's there if you need it. And there are also what I would call like provider groups. There are a few different types of these. So you have group practices, like group therapy practices. I went and visited one in town. They call themselves like Elevate Mental Health, and they have a group of clinicians that do their own thing. They also have groups, stuff like that. So group practices, which are multiple clinicians operating under the same banner. You have healthcare networks like, say, Kaiser or Sutter Health. And you have startups that are more tech focused and have a network of providers like, say, Foresight Mental Health. Lastly, you have larger organizations like NAMI, National Institute for Mental Illness, or the International OCD Foundation, and these will have resources for helping you find a therapist as well. One of the most important things with finding a therapist is looking for a good fit for you. So it's totally okay if this includes things like gender, culture, membership to certain groups, right? If you want, say, a queer therapist or something like that. Or if you're looking for somebody who does maybe religious work within a certain religion, you can find those things as well. It can take some trial and error, and that's totally okay. It's definitely an active effort to find a therapist, but it's totally worth it when you find somebody that just gets you and knows the right approach to get you moving in the direction that you want to go. So yeah, that's my guide for you. That is my guide for finding therapy. Thank you for listening to this epic episode. I know it was long, and I sincerely hope that this helps. If you want to find all the information presented in this episode so you can review it, so you can read through it, head over to duffthepsych.com/episode 397. And if you have any further questions for me, just shoot me an email to duffthepsych@gmail.com. Thank you. Please share this episode if there's somebody that you think would benefit from it. And I'll see you for the next episode. Bye. Thank you so much for joining me in this episode. If you would like to send a question or a topic for a future episode, please email me at duffthepsych@gmail.com. If you like my approach and would like to learn more about my books, online course, or other resources, please head over to my website at duffthepsych.com. And lastly, it would mean so much to me if you would leave a review for the podcast wherever you listen to it, or share an episode with a friend. Until next time, you got this.